All right. Hi, everyone. Thank you all so much for joining us this evening. My name is Michelle Hayes, and I'm a legal counsel for the Lawyering Project. I was a legal fellow with the ACLU of Kentucky, and I've been dedicating my legal career to high impact litigation that centers equal access to reproductive health care while also advocating for reproductive justice policies on the state and federal level. I'm really excited to be here with you all this evening to discuss work currently being done to address the racial disparities facing pregnant Kentuckians. We know that Black and Brown Kentuckians are nearly 3 to 4 times more likely to die from complications during or shortly after childbirth than their white peers. This disturbing trend is even worse for Black Kentuckians and applies regardless of education, income, or class. Research points to implicit bias in research as the root causes of these deadly trends. So tonight, we will be sharing a screening of a video featuring advocates, policymakers, medical professionals that highlight the barriers pregnant people, especially Black folks and people of color, face to have successful and healthy pregnancies. After the screening, we will host a roundtable discussion with the participants of the video. We will be joined by Dr. Tanya Franklin, Angela Hardison Breckenridge, Alexa Hughes, Jackie McGranahan, Representative Scott, and Dr. Serena Williams. So thank you, everyone, and we hope you enjoy the video.
There is a lot of media attention to maternal mortality in the Black community, and they're scared.
One of the things that was so striking to me about the Serena Williams situation was that she is an athlete who literally makes her living knowing her body.
They still didn't even choose to believe her, like, man.
The reality is they are wealthy and they can get the best health care, but that doesn't mean that they're going to be believed when they talk about their pain or that they're going to be taken seriously.
Can't talk about maternal mortality without having the conversation that Black women are 3 to 4 times more likely to die than their white counterparts.
Black women have always had worse health outcomes. There's a reason why we still see these health disparities that has nothing to do with the people themselves and everything to do with the system.
60% of our birth deaths are preventable.
A person's birth experience should be about more than survival.
If you look at a lot of the reports in articles and women on social media talking about their birth experience that they had a difficult time with, the common thread is that no one listened to them and that no one took their concerns seriously, and also that no one cared.
Maternal mortality can look like a bunch of different things. Often we think of the hemorrhage during childbirth, but it can be dying from an infection a week later. It could be a car accident because the seatbelt isn't properly protecting the woman.
How do we make sure that we're getting the data that we need around infant mortality and maternal morbidity and how do we make sure we put that information out publicly so that all of those different entities who are addressing this issue have shared data, shared information so that we can move forward together to really address the needs of pregnant people across Kentucky. What I think more and more people are beginning to learn and to understand is that there is a real disparity in health outcomes for Black women and white women.
This has been something that has played out in our society over centuries, that when there's racism and bigotry and segregation, that has lasting effects throughout the generations. When you look nationally, only 5% of all physicians are Black, and that doesn't match up with the patient population.
When there has been this legacy of pain and mistrust, and not just in birth, but in other areas, then there's a tendency to feel safer with the person that looks like you.
The care that women need and what they're searching for in their pregnancy and prenatal care is multifactorial. It requires multiple people to provide multiple aspects of care. I can provide medical care and support on some level, but then a doula will be able to maybe even go to their home, talk with them postpartum, spend time with them and check in with them on a more regular basis and spend more personal time with them.
The midwife was somebody on the plantation. She was the jeweled prize because unfortunately in the colonizer's eyes, without her and her knowledge, his cargo didn't get here, you know? But for the people of the plantation, that was their lifeline. Nobody else was going to care. Nobody was going to come help them. She was not just a birth worker. She did everything. She was honestly more of a community healer.
I had a client a while ago, maybe a year or so ago, who had endured some trauma even before birth and was even at 2 or 3 centimeters, going through a lot and screaming and really, and the doctor basically told her, it wasn't the doctor who was with her during delivery, but the doctor that she initially, saw when she was in labor. It's like, if you can't take this pain now, you're not going to make it to 10 centimeters. Why would you think it was okay? I was working with a partner for that birth. And so my partner is white, and they knew her. This other doula would say, "Oh no, that is absolutely unacceptable, and we need a new doctor. Doctor, how dare you?" I know that there would be a good chance that if I said what she said, that I would be seen as this, belligerent, angry Black woman and may get kicked out of the birth rather than someone who really, really wanted to support my client who is in emotional and physical pain.
We in this country have not really built a system designed for health. And when you think about our healthcare system, it has not been designed for all people.
Any medical personnel, I don't care at what level, is always taught that your care that you provide to that patient is based off of their response. So I teach my clients to ask the right questions.
Once a woman or person has given birth, there's this question of, is this pain normal? Am I feeling right? Because it's a traumatic event and there can be all sorts of things happening. And I think sometimes physicians don't necessarily may underestimate what a woman or person is telling them after they've given birth. And people may not want to say like, hey, there's this thing going on and I don't know if it's normal or not. And I think that lack of communication can really lead to some challenges.
There are actual ways that you can, evaluate a postpartum, mom and see, okay, she might need some extra help. Paid parental leave, real paid parental leave, and not like, in 2 weeks I gotta go back, contrary to what it looks like in Hollywood or whatever, like popping back out into the world after 2 weeks, isn't the best thing for your body. You grew and, released in a whole person. And, it takes some time for your body to restore.
Experts believe that postpartum care should be extended. There's so many things that can go wrong and so many stressors that can happen in those first 6 weeks after their birth that we probably need to be more connected with them and have more office visits or more telephone calls with them to make sure they still feel safe and supported.
That's why I do what I do as a legislator in our state capitol, in the People's House in Frankfort, Kentucky, and fighting for, good access to healthcare and healthcare that's free of implicit bias or institutional and systemic racism.
Everybody has implicit bias. We all do. And it's all about how we actually recognize them ourselves and then what we do to take steps to correct it and make sure that our implicit bias isn't hurting the community that we're trying to serve.
I am able to talk to medical students and residents about this topic. So we've got the new generation of doctors coming up, having had these discussions and being knowledgeable that there is bias out there that impacts patient care.
The Maternal Care Act for Kentucky would address institutional and systemic racism in healthcare. It would provide Medicaid reimbursement for doulas, and it would also make sure that we're capturing the data that we need to make sure that every entity across Kentucky that's addressing this issue has that shared information.
If situations are better for birthing families, then the whole, community thrives and it keeps reverberating.
Mothers are the cornerstone of our society. We depend on them so much. We have to protect them at all cost. They birth life into this world. We would not be here if it were not for mothers. And so it is our duty to protect them.
Wow. Every time I see and watch this video, I get chills, I feel inspired. And hopefully by informing more people about the risks that Black pregnant people face in Kentucky, we can all work together to ensure that safe and healthy pregnancies for both the people giving birth, their babies, and their families is a reality. So in order to kick off our roundtable discussion, I'll just introduce our panel, introduce our experts here, and I'll let them tell you a little bit more about themselves. So first we have Angela Hardison Breckenridge.
Hello, my name is Angela Hardison Breckenridge. I am a birth justice doula, a lactation educator, and owner of Hens and Chicks Birth Services. I'm also a birth advocate and consultant for Southern Birth Justice Network. I offer full spectrum doula services, including preconception, birth, and postpartum support, as well as pregnancy and infant loss advocacy.
Awesome. Thank you so much for being here. Next, we have Alexa Hughes.
Hello, everyone. Thank you for joining us. My name is Alexa Hughes, and I'm the founder of Granny Girls Birth Initiative. Granny's Girls Birth Initiative focuses on being advocates for breastfeeding and birth rights for women who are incarcerated, residing in shelters, women in transition, and teens in the foster care system. I'm also the founder of Alexa's Birth Services as a labor and postpartum doula and a lactation educator. I'm also an aspiring upcoming certified nurse midwife and an IBCLC in training.
Thanks, Alexa. Doing all the things. We appreciate you. Next, we have Jackie McGranahan.
Hello, everyone. My name is Jackie McGranahan, and I am a policy strategist with the ACLU of Kentucky, and I'm working very specifically on the Reproductive Freedom Project and LGBTQ+ rights legislation. I work with community members, advocates, and policymakers to ensure that Kentucky passes legislation that centers people most directly impacted by reproductive access disparities and creates lasting change for families across the Commonwealth. And I'm so happy to be here today.
Thanks, Jackie. Next, we have Dr. Serena Williams.
Hi, thank you. So I'm Serena Williams. I'm an associate professor in the Department of Health, Behavior, and Society in the College of Public Health at the University of Kentucky. My research focuses on maternal and child health, and really specifically is focused on the field of intimate partner violence and reproductive health consequences experienced by adult women. I've also done a lot of work looking at program evaluation and data analysis. Thank you.
Awesome. And finally, but certainly not least, we have Representative Attica Scott.
Thank you so much. Ooh, I hope everybody soaks in all this power on this call. These are some phenomenal women. I am State Representative Attica Scott, and I serve Kentucky House District 41 in Frankfort, which is here in Louisville, and it stretches all the way east to Westport Road and west to almost Chickasaw Park. And my work has centered around maternal and infant health. As y'all may have seen, the Women's Caucus in Frankfort filed a series of bills related to maternal and infant health. It's focused on racial justice and issues related to education that young people have brought forward that they would like us to address.
And we also have Heather Eyre on the call with us today, so we will open up the floor to you.
Thanks, Shay. My name is Heather Eyre. I use she, her pronouns, and I am the campaign coordinator with the ACLU of Kentucky. I'm here to listen and learn from all of you all of the experts. And then at the end, I'm going to let people know how they can get more involved in helping close the huge gap in how pregnant people of color how they experience their pregnancies, how they experience postpartum, and hopefully you all are able to enjoy listening to all these amazing people.
All right. Well, thanks everybody again for being here. We may also be joined by Dr. Tanya Franklin later on in the program as well. So like I mentioned, this will be a roundtable discussion where you all can speak whenever you would like, or if there is a specific question you'd like to answer, please feel free to respond. So to start off our conversation tonight, I'm gonna go over to Jackie. So can you tell us where the idea to make this video came from?
Absolutely. Had to unmute myself. You know, every time I do it, every single time. So we started work on the Maternal Care Act going on 2 years ago. And it was when I first started at the ACLU of Kentucky. And of course, this is an issue that directly affects myself, my family, my daughter. And so it was the first conversations that I had working with anyone in the General Assembly was speaking with Representative Scott and hearing her passion around this issue. That was the start of this long journey that we've been on. When the Maternal Care Act first began, it started as an omnibus legislation. What is now broken up into 3 different bills at the time was one large bill. And how Representative Scott got to the places that she got to was so much research, talking with birth justice advocates around the state, talking with experts, talking with doctors and other people who are in this field, having numerous conversations with folks on the task force, the perinatal qualitative task force. I hope I'm saying it right. It's always a mouthful. But one thing that is very apparent is that Black women and also women of color are dying at rates so much higher than their white peers. And this is a scary reality. And the fact of this situation is that it just continues to get worse. It's each year that this the 2020 report just came out. And what we were looking at when we first started doing this legislation, I think it was at 36.2 per 100,000, and then it was 38. And now on the 2020 report, it's now at 40.2 per 100,000 as compared to 17.1 per 100,000 of our white peers. And that's so scary. And these things that are happening aren't just happening to Black mothers and mothers of color. It's also happening to Black infants and babies. And there has to be something done. It's a no-brainer. And the first conversations that I was having with legislators around, and I'm sure Representative Scott will tell you this was her experience as well. A lot of people were like, what is that? Like, that's not real. That's not happening. If that was happening, everyone would be talking about it. And I'm like, no, it's happening. Like, I'm telling you, this is an issue. And then once you're making folks aware of the issue, it's like, well, I think we need to talk about substance use disorder as a problem. Like, of course that's a problem, but we have to address this on a state level. We have to address this on a national level. And the fact that this legislation is spearheaded by a Black mother, like that's not by coincidence, but the Maternal Care Act came back in 2021. We didn't make it as far as what we would like in the 2020 legislation. COVID changed the outcome of the entire General Assembly. But in 2021, Representative Scott came back, and this year, after speaking with other legislators who'd worked on it in different places, it was broken up into 3 different bills, with one bill directly addressing reimbursing doulas through Medicaid, another bill regarding data collection, and another bill attacking it from the implicit bias front. And this is legislation, of course, that we are supporting fully. And this was another year that this legislation did not pass, and with Black Maternal Health Week and the success of getting, now I think when folks talk about maternal mortality, people are aware that this is an issue. People are aware that Black women are dying, that Black parents are dying at rates higher than their white peers. We know why. And so the education part is happening, and now it's time for all of us to get together and advocate for real change. We've got to do something different. But I won't take up the time from the other experts. But one thing that I do want to get a little bit more information from is to Dr. Corinne. I have 2 questions for you. Why has maternal mortality become such a hot topic recently? Why was it that before, when we were talking about it, no one knew what we were talking about, but now everyone wants to get involved? I mean, I'm all for it, but can you explain that to me? And why is there a lack of local data on maternal mortality?
Yeah, I'm happy to answer those questions. And I've been in the field of maternal and child health for over 20 years at this point, and it's really interesting to have watched this happen. And I'm going to be perfectly honest, when you think, I think the answer to why has it become such a hot topic is truly because there was a celebrity willing to talk about their story, to be perfectly honest. And we've seen that happen in the past with other things. You think about Angelina Jolie, when she talked about being positive for the BRCA gene, right? There was suddenly this movement to get tested and understand what that risk was. We saw, different ovarian cancer prevention programs suddenly became much more popular because people were like, wait, this is a thing, I should learn about this. And I'm gonna go ahead and say, even though their data has been somewhat limited at times, this is not a new phenomenon. It's not like the maternal mortality rate suddenly doubled in 2019, 2018, and particularly not that disparity. That disparity has been at about 2.5, 3 for comparing Black women to white women for probably 40 years, so I just want to highlight that we're talking about this now and we're talking about this impact, but it's truly a thing that has been going on, just hadn't received that level of attention. And I am always, it's that mixed blessing, right? Like, I'm very happy that something finally shined a light on this topic, because Black women have been dying at rates that are ridiculous compared to those of their white counterparts, and there hasn't been the attention paid. So I'm very happy that we have the attention. I hate that it had to come this way. You also mentioned just briefly infant mortality. I'm going to say this, we think about these disparities that we're talking tonight, obviously about maternal mortality, but you're right, there's about the same disparity. Black babies are about twice as likely to die as white babies in this country. There was an article published not too long ago, and I made my students read it, and they were shocked because if you look at about the last 10 years, there's about 60,000 Black infants that are no longer alive only because of that disparity in the United States. And when you think about that 60,000 grieving families, like that's just unimaginable to think about what we could do to prevent that. And I think about that with maternal mortality, that as much as we talk about these as statistics and numbers, if I remember correctly, the last year data we had, there were 41 women, I think it was 41 women in Kentucky who were coded as having a maternal, dying from a cause related to maternal mortality. It's 41 families that are grieving in Kentucky that shouldn't be without, there's kids growing up without their mothers. So I just want to highlight that when we talk about these disparities, we're really talking about people. And just, I realize that's weird for me to say as a researcher, but I always want to stay connected to why I do the work I do. I also think you asked about the local data, and I'll just say quickly, one of the challenges with that, for as large as the numbers are, we are relatively, and I'm gonna say relatively fortunate that our maternal mortality rate is low compared to like globally. When you think about other countries that don't have nearly, it's way too high for a country given the health resources we have. We should not be sitting where we are today. But that means that it's really hard to have numbers of data broken down how we would need to really understand what's going on and how do we get at the root causes of this. I've been working with a student looking at maternal health outcomes sort of generally defined, and she's really interested in Black Appalachian women. It's a really small group of women, and we just don't have, fortunately, we just don't have enough data. And I think that does limit some of what we're able to do and analyze. And we really have to think then of more general approaches while we try to compile the data to let us look and evaluate these cases. This is also where I think recognizing that the numbers are relatively small, doing things like case reviews, where you can do a really detailed analysis of what happened in that case is important. The last thing I'm going to say, just because I think it's important to remember, is mortality is the absolute worst outcome. We have so many more women who have what I think of as near misses, where but for one little thing going wrong, they would have died. And there's a lot of that happens that doesn't get captured in these statistics, that I think is also a place for us to maybe think about spending some energy and looking at that data, because I think that can teach us some lessons. I'm going to ask, if it's okay, a question of Angela. And this is something that I think is really interesting. How can non-medical people help address the systems of racism that exist in our healthcare systems?
So as you and Jackie mentioned, education is key. We have to, once you learn something, no matter who you are, you have to be willing to share whatever you know about maternal health and birth inequity with anyone who listen, and even those that don't want to listen, even folks who are resistant to the fact that it's been proven that racism is the big factor that's endangering the lives of mamas and babies. Maternal health disparities have been a growing issue for decades, as was mentioned before. So there's no one and done fix. The problem is multifaceted. And birthing families should be aware of their options, even when those options seem limited. Here in Kentucky, we've been and continue to be, in my opinion, stuck in a holding pattern. We don't have birth centers. And we've just recently come to a point where there's access to certified professional midwives, but there aren't enough. We don't have enough access to culturally congruent care. Even in the best hospital situations, every family should have the option and the support to birth where and how they desire. And so our approach has to be holistic. We should everyone, be looking for ways to assure that the conditions for birth are optimal for all people. And we have to be willing to address racial and social inequities as a sustained effort. As I mentioned, a one and done is, that's not gonna work. Whether you are a policymaker, a teacher, a minister, an artist, whatever your role in the community or society at large, you have a place in the fight. Educators should talk to their students about midwifery and doula work as career options. Schools and families also need to encourage and inspire more Black students to go into healthcare professions, including becoming physicians. I was a public school teacher for quite a few years, and I always had conversations with kids beyond what I was expected to just teach in the classroom. And I wanted to have conversations around what they wanted to do with their lives, what their futures would look like to them. And a lot of them thought it would be easier to become a professional athlete or an entertainer than a doctor. And when we dived in deeper into this dialogue, I learned that a lot of times the motivation to follow a career in health sciences was there, but the support system wasn't. Lawmakers can write policy that allows for things like birth centers, paid parental leave, and better access to doula care, but they should also uplift and support these policies across the board and across the aisle. True bipartisanship is necessary for strategies that will best serve all birthing families. And I think about clergy as well. Ministers need to openly talk about health disparities and what the churches can do to support birthing families in our communities. Are funds being raised to make sure that Black youth have the same opportunities to work in healthcare as their white counterparts? So that mamas and babies can have access to culturally congruent care? Or is that money used to make sure that ministers have the most expensive car, the most infamous megachurch, or a private jet? Are these, and I'm talking about not just locally, but nationally, that these things are, there's a message of prosperity that's being pushed without the message of taking care of people in the community and seeing what we really need. Are there community birth education classes that are made available to your congregations? And who's checking on the postpartum mama to make sure that she's okay? We can't assume that someone else is taking care of it. More than half of maternal deaths happen during the postpartum year. And if the visiting team, I know when I was coming up, they used to call it the sick and shut-in team. If they can't be there for that family in meaningful ways, then there should be funds made available to hire a doula for them. And we can't just shake our heads and go, oh, what a shame. As a society, we just have to do better.
Thank you so much for that, Angela. Oh, I'm sorry, did you have something else? Oh, okay.
I had a question for Alexa about the role of doulas and midwives in this fight.
Yeah, thank you. I do feel like doulas, birth workers, and midwives can do a lot in this movement to ensure that Black pregnant people are cared for in the same way and have safe and healthy pregnancies as their white peers. And I just want to slow down just in case this is like your first time ever hearing about the the maternal health crisis. And I just wanted to go ahead and put some definitions out there, because I'm going to be talking about and answering this question in two separate ways, and how I feel like we can encourage the movement to help our maternal mortality rates. And then I'm going to be talking about how to encourage the movement for our infants out there as well. So the U.S. maternal mortality rate, the CDC defines as the number of women that die during pregnancy, child delivery, or within 42 days of giving birth. And again, this is per every 100,000 live births. And I just want to highlight the wording, because as Dr. Connie said, like the way our statistics are laid out, we do have these groups that most definitely get left out in there. How she said, like the near misses, these are only for our live births, by the way. And then we have for infant mortality is the death of a child within the first year. The infant mortality rate is the number of infant deaths for every 1,000 live births. And so just for a statistic to like really compare it and really see like what does that mean? In 2017, the total number of infant deaths in the United States was approximately 22,258. And the infant mortality rate was 5.8 deaths per 100,000 births. So that way, compared to being down from 7.1 in 2005. Just the way when we read these statistics, it really to me like minimalizes it. So I always try to read that number aloud so people like really see like what we're fighting against and things like that. And the one way that birth workers, midwives, and doulas is most definitely giving our history and empowering our women to do the lifestyle changes that are actually needed. Because unfortunately, because the stereotypes that are out there that are then inflicted upon our care plans is what we're telling our women to go home and do. And it's not accurate, you guys. For example, we are not at higher risk because Black women are welfare queens, or we do a whole bunch of drugs, or we're drinking, whatever ignorant silliness of a lifestyle that we're stereotyped to believe that we do not lead clean lives. 110%, we are still more likely to have and pass from maternal issues than a white woman that smokes during her entire pregnancy, which is an actual, risk factor. Not supposed to do that. Some people don't agree with that either. Realistically, you're really not supposed to do that during pregnancy. It raises most definitely a whole bunch of risk, and those women are still birthing better than us. Now, lifestyle changes that we actually teach is letting them know the history so that we can get rid of the generational curses. For example, it's been passed down that we don't need to lactate anymore because we were originally used as wet nurses to feed white children. So now it's been passed down, or it's been looked at, oh, I don't know why you're choosing to breastfeed. We don't have to do that anymore. We don't have to do that. We're not forced to do that no more. You can go get the formula like the white mamas now. Like that's something that's been passed down in that way of thinking. And it's most definitely like colonizers have put that in other different people of color. Like when formula first came out, y'all, they was going straight over to India and telling these women, oh no, your milk is dirty. That colostrum that comes out yellow, yeah, that's dirty. That's why it's yellow like that. You need to have this formula. And they would give them a sample, and then it was enough just so that their milk would dry out, and then they became dependent on it. And like even still this day in that culture, when you are when I'm working with Indian women, they will literally say like, oh, that's dirty, my milk is dirty, I haven't started giving it to my baby yet. That's where that comes from. So knowing the history and what we've been told, like literally, I feel like that's what it means. And that's why midwives and birth workers, and we're really strongly when we say what it looks like to decolonize your practice. It doesn't matter if you're a lactation consultant serving Black people or Black people of color. Like, I don't care if you're white and serving. Like this also, you need to understand the history so you can understand where this misconception comes from. So you're not looking down on them talking conceit as well. Like, why would you ever have this type of myth or misconception? Like, it is 110% real, and we need to teach the history on that. Like, yes, we may have had to do that, but this is still the best thing for your baby. You know what I'm saying? And then we go on to talk about not having the support. People don't even know what a lactation consultant is sometimes. They haven't even heard of that birth professional. And also as doulas, like in midwives and birth workers, we educate our clients on the complete spectrum and roles and scope of practices of different both professionals. That way you understand that you have stepping stones and more choices to decide from than just one versus the other or one extreme to another. You do not have to go straight to the hospital and get an epidural if you're somebody that's trying to have an unmedicated birth. And it's not about, people feel like, oh, somebody's like having an unmedicated birth, like it's a big misconception, like, oh, she's just trying to conquer and stay strong and said she did something. Like, what if she was one of those people where during her first baby the epidural really did slow down her birth? She was in there 30 hours. So now she's just trying to hold off as long as she possible. Okay, let's go in here and get this nitrous oxide, aka laughing gas. Like that was literally the first thing for pain management that we had for women worldwide was laughing gas. And it's been used everywhere else in the world. But of course, here in America, we mixed it with other drugs. So we made it illegal, but really what it was is the nightshade that we was mixing with the nitrous oxide, y'all. And it literally took us here in Kentucky, we didn't get nitrous oxide as an option back for our women to what, like 2016 or something like that. And that's another thing is that as birth professionals, like they don't know, we have to teach our public what to advocate for. Like Angela said, education is key, and it's 110% been proven that women that are able to get more information and make more evidence-based decisions about their healthcare and make more informed consent have better birth outcomes. Obviously, the more that you know what you're talking about, the better choices you can make for yourself. And that's with anything. And we most definitely want to let them know, like, hey, you can take these steps. You don't have to, even after the nitrous oxide, you have Demerol. What's the side effects of Demerol? Why did they stop? Did you know that a lot of hospitals stopped using Demerol because it was causing women to have surgeries? And now there's this new one called Stradol. You know what I'm saying? Like just because they offer it to you, then it's talking about like, you know, why this drug is starting to get to be the more protocol drug versus the other. There's a reason for it. They might not have advertised it. They don't want you to know it because, you know, they be trying to like, oh, okay, we see the statistics. Don't let nobody know we messed up, put it underneath the rug. But no, it really does actually matter. And I really 110% believe that that's how we're going to get people to do better, is to really like realistically look at the lifestyle that is true, that changes that actually need to be made. Once we get moms on board with supporting more lactation and being more willing, once they realize that this is something that's very beneficial, that's going to help the infant mortality rate. One of the top reasons why our babies are dying is low baby weight, you guys. And literally breast milk is the best way to help that out. Like my lactation educator in training was telling about how like they had this baby, they was really trying not to let baby go in an NICU. They lost a whole bunch more than 10% of the baby weight that's expected in the first week of life, wasn't gaining nothing back. So they froze the milk so that the fat would come off the top, and they was just feeding the baby the fat so they was getting all the good stuff and then supplementing with the rest of the breast milk once it melted down. And baby was able to get the weight, everything was great within that week. You know what I'm saying? Like it's really true. And then also just again, like understanding your full scope of practice. I had a labor and delivery nurse, y'all, a client of a labor and delivery nurse that even worked in a natural birthing center. We were trying to figure out why it is her baby was not latching. Like this was her third kid. She's like a master at this. Her baby's jaw had gotten so much pressure coming down the vaginal canal, it was unaligned. So we looked up all the services of a Webster certified chiropractor, which is a chiropractor that was specialized to work with pregnant women and infants. And honestly, even I was ignorant to the fact or had the misconception, like they actually do things with infants as well that would help with lactation. So within 2 sessions, baby's jaw was realigned and we no longer had painful breastfeeding, things like that. If you went to somebody else that was ready to be cut happy and trying to get some plastic surgery money, like we probably could have been in a whole different other situation for no reason. Like, do y'all see what I'm saying? There's levels to this stuff, and we need to help them in the in between to avoid these C-sections that our moms are dying more from on the postpartum stage. And again, with the low baby weight, everybody wants to talk about SIDS. That's number 3. Low baby weight is number 2 on why our babies are dying. It's a big deal. It's a problem. So 110%, our birth workers can help by showing the history and why we need to be looking into the decisions for ourselves. I bought into a service placenta encapsulation, but then the more I started going to birth trainings led by Black women. I learned that that's not even in our ancestral history, that we buried ours 18 inches, and we was taught that that protected the life of the fetus that came from that womb and the future fertility of the mother that birthed that placenta. So now I've been telling my clients, like, why don't let's do placenta planting, educating them more on that. That's the way it should be. And I think that's the importance of even having birth workers of color, because it's not about just making no money, or it shouldn't be. I'm not going to sell you this service, even though I found out late. I'm not going to be like, other professions, that we're already complaining about, that we've seen better, we know better, but there's too much pride to roll back and then now put out the new, better information, And I think that as well is another reason why we need midwives and things like that, because we're a lot more honest. I mean, I'm not just saying like that, but like, we're not as prideful to the point where we're going to cost somebody life. We're not supposed to be anyway. Okay. I feel like I could go on forever, you guys. Let's pass it on. Thank you very much. It was a really good question. Okay, now we're going to move on to Ms. Rep. Attica Scott, and I just wanted to ask you, can you talk more about the Maternal Care Act bill package to the Democratic Women's Caucus introduced during the 2021 legislative session? What are some action steps that the public can take to help get Maternal Care Act heard on the floor and passed?
Thank you, Alexa. I could have kept listening to you. That would have been fine too. But I will answer your question. So yes, we had more than a dozen bills that were filed as part of the maternal and infant health package of bills that the women of the Democratic caucus filed back in February of this year. And I just have to say that it makes a difference when women are in office, because we see what's happening with the Black Maternal Health Omnibus Act in DC, and Congresswoman Lauren Underwood having her first bill in that package passed today related to protecting veterans' maternal health. So that matters. And so we've got several bills. I won't go through all of them, but just to highlight, just so y'all know the breadth and depth of what we were thinking about as women in office, some who have birthed children, some who have not. There was a bill related to bereavement leave for miscarriage or death of a child under 1. Y'all, thank you to Jackie. She's talked about a couple of the bills that I filed, the one to require Medicaid coverage of doulas, and one related to midwifery, doula, and breastfeeding assistance, as well as parenting education. There was a bill related to breastfeeding supplies tax exemption. Yes, thank you. There were a couple of bills related to Medicaid coverage of midwives. There's a bill related to requiring insurance coverage of formula that is prescribed by a doctor and medically necessary. A bill related to expansion of the scope of the existing HANDS program to include offering maternal and postpartum depression services. Again, more than a dozen bills filed, only one was heard in committee and passed, and that was to require hospital staff to provide information on postpartum depression to women and their families and discuss it with maternity patients before the discharge of that patient, and to make sure that that information was posted on the Child and Family Services website. One bill. Out of all of those more than a dozen bills that were filed, only one bill ended up being passed by the legislative body. And so, not even a bill related to making sure that people who are incarcerated and pregnant don't have restraints used against them during the birthing process. That bill didn't even go anywhere. So, we talked about, I can't remember who mentioned bipartisanship, but the reality is, those of us who are members of the Legislative Black Caucus get asked all the time, are we working in a bipartisan way? But our 94 white colleagues very rarely get asked that question about our bills, and are they supporting bills to save Black women's lives? They don't get asked that question. So, to the point that you asked me, Alexa, about what people can do to help get these bills heard in committee first and foremost, and then on the House floor, ask those questions. Ask these lawmakers, are you supporting these bills that would literally save the lives of people who are birthing, and in particular of Black women and who are birthing and who want to give birth? I think it's important for folks to make sure that your state representative is signed on to these bills as a co-sponsor. That matters. That sends a message to you that they care about these issues because they're willing to sign on as co-sponsors of these bills. I think it's vitally important to contact the Speaker of the House and the chair of the Health and Family Services Committee to say, it's important to you that these bills are heard. They need to hear from more and more people about the importance of maternal and infant health and making sure that these bills have the light of day. Even if, and Jackie and I talked about this quite a bit, even if it is initially to hear the bills as an opportunity to educate people who, one, I think in some cases want to feign ignorance. They are not that ignorant. So they know that we are dying. But two, there are people who aren't aware. And so it's an opportunity to educate them. So please keep pushing. Please keep making sure that people who are in elected leadership, like the Speaker of the House, don't get away with not giving our bills the light of day. So thank you so much for that question, Alexa. And I want to make sure that I ask my question, and I think that it is here. So Heather, I'd like to know, what can the public do to support the work of the ACLU, and how can they get more involved, in particular around the topic that we're discussing tonight?
Thank you so much, Representative Scott. And thank you for filing all of those bills. And thank you so much for the work you continue to do and the fight you continue to fight in the legislative during every session and in the General Assembly, even during the interim. But thanks for that question. So at the ACLU of Kentucky, we obviously are easing back into in-person volunteer activities, in-person events and all of that good stuff. So when I'm finished speaking, I'm going to put a link in the chat for everyone to sign up to be a volunteer with us. There are lots of different issues that you can work on. Obviously, tonight we're talking about maternal health. And so that is one of the issues you can check. We're going to be knocking doors just to, like everyone on the call has said, there are a lot of people who don't realize the huge gap between, or like the disparities that happen all the time within healthcare. And so we at the ACLU want to inform those people. It's not necessarily telling them to do one thing or another, but we want to help inform the public. So we're going to be knocking doors. We've already been doing a lot of text banking. You can join us doing that, phone banking. And then also during session, we host lobby days where you can actually go in person. Hopefully by 2022, we will be going back to Frankfurt in person. Jackie and other ACLU staff people will be going with you to Frankfurt for a full day of meeting with legislators, talking to them about what's important to you and why it's important to you. Because like Representative Scott said, we have to keep pushing. We have to keep pushing the people in power to care about us and to care about our communities and the people who we also care about, because we need to make this a more just and equitable Commonwealth for everyone. Like Angela said, this is kind of like a nonpartisan issue. The ACLU of Kentucky is nonpartisan, and this issue should be as well. This issue is about saving people's lives and ensuring that they have healthy outcomes when they're pregnant and after they give birth. So we have lots of different ways to get involved. You can also find local doulas, talk to them about what help they might need. They might have their own, they might need help just like delivering postpartum supplies. They might need help getting donations of those supplies. So always, you can follow the ACLU of Kentucky on Facebook and Twitter and Instagram. And we love to share local doulas and local birth organizations, the needs that they have. So we hope that you all will get involved. I'm going to put that link to sign up to volunteer with us in the chat, and I'm going to pass it back over to Michaela.
Thanks, Heather. And thanks again, everybody, for your thoughts, your insights on this particular issue. As we continue to work together, it's always great to come in just to really educate people, spread the knowledge, and help them get just as excited as we are about pushing for healthy families to be a reality in Kentucky. So before we wrap up, I do want to just give everybody a chance to just let folks know how to reach out to you if they have questions or concerns, or if they feel like you can help them talk to their friends and families about maternal health and how they can just get involved. So I'll start with Jackie, and then we'll kind of work our way through so everybody can just put their, Jackie's putting it in the chat. That works too. If everybody can just drop it in the chat. There we go. That works. Zoom. Thank you, Zoom. But again, we just want to thank everybody for coming out tonight. Of course, the fight for maternal health is continual, and we will continue to push for these bills to continue to support our representatives who are highlighting these issues. And we also push for the rest of the General Assembly as well to take heed to this and to know that this is an issue that we want resolved. And we will continue to do what needs to be done until it is. So thank you everybody again for coming. We hope you all have a great night. And we'll be again soon. We'll continue to work together. So thanks everybody. Have a great one.
Thank you.